Bridging Global Standards, an introduction to international patient departments in China's tertiary Class A hospitals. In the landscape of global healthcare, China has undergone a monumental transform over the last 2 decades. At the pinnacle of its medical system are the tertiary Class A, 3A hospitals, the highest designation for healthcare institutions in the country, to meet the burgeoning needs of expatriates, diplomatic staff, and international medical tourists. Many of these elite institutions have established international patient departments, IPDs. These departments represent a sophisticated fusion of traditional Chinese medical excellence and Western clinical standards, offering a bridge for patients who seek world-class care within the borders of mainland China. World-class clinical expertise. The most significant asset of the IPDs in China's 3A hospitals is the human capital. The leading physicians in these departments are not merely local experts, they are global medical citizens. A vast majority of the senior consultants and department heads in these wings possess extensive academic or clinical backgrounds from the world's most prestigious medical systems, particularly the United States and the United Kingdom. It is common to find surgeons, oncologists, and cardiologists who have completed fellowships at institutions such as the Mayo Clinic, Massachusetts General Hospital, or the Cleveland Clinic in the U.S. or have undergone rigorous training within the UK's National Health Service, NHS, frameworks at Oxford or Cambridge University hospitals. This international exposure ensures that the doctors are fluent not only in English but also in the global language of medicine. They practice evidence-based medicine, follow international clinical pathways, and maintain a bedside manner that aligns with Western expectations of patient autonomy and informed consent. For the international patient, this eliminates culture shock often associated with foreign healthcare, as the diagnostic logic and treatment protocols are identical to those one would receive in London, New York, or Boston. First-class medical facilities and technology. Complementing this world-class expertise is an infrastructure that rivals the most famous hospitals in the West. China's 3A hospitals are often the first in the world to adopt the latest medical technologies. The IPDs are equipped with diagnostic and therapeutic hardware that is essentially the same as, and in some cases more recent than, their counterparts in the USA or UK. From the latest generation of Da Vinci robotic surgical systems to advanced proton beam therapy for cancer treatment, the technological arms race in Chinese 3A hospitals has resulted in a first-class environment for complex procedures. Diagnostic imaging suites feature high-Tesla machines and ultra-fast CT scanners that provide the clarity required for precision medicine. Furthermore, the laboratory facilities in these departments often hold international accreditations, such as CAP or ISO standards, ensuring that pathology and blood results are recognized by medical institutions worldwide. The physical environment of the IPD is also designed for comfort, featuring private suites, bilingual signage, and high-end amenities that mirror the concierge medicine experience found in premier Western private wings. A seamless integration of care. The International Patient Department acts as a hospital within a hospital, while it draws upon the massive resources of separate 3A institutions, such as large-scale blood banks, emergency response teams, and multidisciplinary specialty groups. It maintains a streamlined, patient-centric flow. In a standard 3A hospital setting, the sheer volume of patients can be overwhelming. However, the IPD provides an oasis of efficiency. Appointment systems are rigorous, wait times are minimized, and green channels are established for urgent surgeries or specialized consultations. This efficiency is critical for international patients who may be traveling on tight schedules or who require coordinated care involving insurance providers from their home countries. Most hubs have dedicated departments to handle international direct billing with major global insurers such as Cigna, Bupa, and Mesh, making the administrative side of healthcare as painless as the clinical side. The best of both worlds. While the IPDs focus on Western standard clinical excellence, they also offer a unique advantage: the optional integration of traditional Chinese medicine, TCM, for patients interested in a holistic approach to recovery or chronic pain management. Thus, the departments can facilitate consultations with top-tier TCM masters. This East meets West synergy, where a patient might receive state-of-the-art robotic surgery followed by acupuncture-assisted rehabilitation, is a distinctive feature that cannot be replicated in the West. Conclusion: the international patient departments in China's 3A hospitals represent the future of globalized healthcare. By combining a world-class roster of doctors, trained in the rigorous corridors of the US and UK medical systems, with first-class facilities that match the global gold standard, these departments provide a safe, familiar, and highly advanced medical harbor for the international community, whether it is for a routine health screening or a life-saving complex surgery. The IPDs in China stand as a testament to the country's commitment to medical excellence without borders.